Hi everyone, I'm Dr. Zia, clinical psychologist specializing in transgender care. Welcome to my channel. This is another one of the Q&A series where I answer your specific and direct questions. As long as they're not diagnostic in nature and can be generalized, I will go ahead and answer them. So if you do have questions for me, please make sure to leave it below in the comment section. You can also email them directly to me. My email is in my bio information, and that way I can go ahead and answer them. One of the things that I gotta mention is that I am now including timestamps for each one of the questions so that we can jump around depending on what you're interested in. And as well as I mentioned it in the last video in case if anybody missed it, if you posted questions underneath the video in a comment section below, or if you emailed me a question, and if I have seen your question, then chances are I have, because I read everybody's comments on my YouTube channel, unless YouTube by some kind of algorithm magic doesn't post your comment, you would have gotten a response from me. Great question. I will answer it Q&A or something to that nature. That's how you know your question will be answered, and it has been snatched into my Q&A folder. So having said that, let's go over the questions. I have also always blacked out the names of the individuals to preserve your privacy. One of the things I gotta say as I was putting these questions together is I noticed that some of you are starting to be a little bit more wordy in the way you word your questions. So I would like to encourage all of you to please keep your question specific to situation, and try to be as clear as you can. Sometimes I noticed lately a lot of you have been giving me a lot of history, and when I cut and paste the questions and prepare them for the video, it just becomes a little too wordy and can be confusing for a lot of individuals. So just keep that in mind as we go forward. Having said that, let's get started with our Q&A today. So the first question that I got is how to deal with having thoughts of genital mutilation. So I gotta say this. If you are having thoughts of genital mutilation, chances are your dysphoria towards your genitals is very severe. I'm stumbling to answer because the last time I even heard of an account of an individual experiencing genital mutilation was in, I believe it's Randy Ratner book. She's a therapist, and she has a book of her experiences working with trans patients. And she had a client that sadly, unfortunately, has experienced genital mutilation because their dysphoria was so severe and they didn't have access to care. And that book was published a while back, and she must have practiced in the 90s. So I seldom hear people ever having thoughts today about genital mutilation. However, it must be not that super uncommon for you to post this comment. If you have thoughts of genital mutilation, that means, like I said, your genital dysphoria is very severe. I would really encourage for you to seek support in a therapeutic forum in the area where you're located. Even if you don't have a gender therapist, with any therapist to talk about it. I would really encourage for you to consider talking to a provider about hormones if you're not on hormones yet. I would also encourage for you to seek other levels of support. A lot of times, if anybody ever exhibits thoughts of genital mutilation, it is because you are not dealing with the severity of your dysphoria. And when we're not dealing with severity of our dysphoria, we can start having this type of thoughts. Be careful. You do not, let me repeat myself, you do not want to hurt yourself. You do not want in any form or shape take matters into your own hands, because it can be life-ending. It can be really dangerous. So I really encourage for you to reach out for support, really encourage for you to consider to be on hormones if you can be, and talk to provider. And if you have genital dysphoria this severe, what are your options? What can you do about it? So this is what I would really recommend. But again, I see this rare. I know a lot of you watching this have a lot of genital dysphoria. Some of you have mild, some of you have no genital dysphoria. For those of you who have a lot of genital dysphoria, I seldom see thoughts drastic as this entering your head spaces, because a lot of you are on hormones or doing other elements of gender transition, and that in of itself has already alleviated a lot of distress you feel. So that would be my suggestion. Second question. So this is wordy, so I will read through this. Again, please make sure your questions are a little bit less wordy, just for the format of this Q&A series. So first, I have a therapist who prescribes my antidepressants and my transsexual care. There is so much about gender dysphoria and lately not being able to get SRS. Okay, so this person is getting antidepressants to manage their, I assume, depressive symptoms, and they're also getting gender affirming care. They're in therapy, and looks like they are also thinking about gender reassignment surgery. I've been treated about 40 years. I do laugh a lot, even at myself, but once I tried to taper, I'm assuming taper off the hormones. Okay, been on hormones for years, total disaster, and took almost 2 months to get back to where I was. My thoughts are, was half dose too abrupt, and three-fourths are better for a long time. Same long time going, half very slow taper. First of all, I'm not sure why you're tapering off hormones. Um, if hormones are working for you, you should not be tapering off hormones unless your transition goals change and hormones are no longer part of your transition goals. If you're tapering off antidepressants, you should definitely be doing that under suggestibility and under supervision of a provider too, because there's a lot of psychotropic medication that should not be just stopped abruptly. So just for clarity's sake, I'm not sure if you're trying to taper off antidepressants or hormones. I'm assuming antidepressants. I'm her only patient on both with a long history of depression. Okay, so you are tapering off antidepressants. Most of the time before hormones didn't even, most of the time before hormones didn't even smile. Okay, that's how bad your depression was. Got it. Hormones seem to fix me, so we both wonder exactly what is going on. Wait until after SRS. What if that never happens? This is in California. Okay. Wyoming 117 states that never expanded Medicaid, so out-of-state surgery and cash only. What if SRS isn't enough? I can't afford electrolysis either. I'm clinically depressed, still chemically unbalanced after long-term hormones? Question mark. What test in my case to determine if I can ever stop the antidepressants? Feel free to put it on Monday. I'm 100% out of for a long time. Don't care who reads or hears it in discussion. Okay. So now I got the gist of your question. Okay. So the question, just to elaborate for a lot of people who feel like you missed out on it. So individual has a long-standing history of depression, had been on antidepressants, then have started hormones. Hormones helped a little bit, stabilize mood, made them smile for the first time. They thought that maybe they can just taper off antidepressants and never be antidepressants. Hormones may be in of itself enough to fix depression. They tried different doses under supervision of their provider, tapered off, lower doses, nothing seemed to work. Now they're considering genital reassignment surgery, and they're wondering at what point, if ever, they can stop, or what test can ever determine if they can ever stop antidepressant. So your situation, if you have started hormones and you're still feeling a lot of depression, chances are, just by the way you pointed out yourself too, you are struggling with chemical or clinical, in this case, depression. When it is clinical depression, it is oftentimes a standalone diagnosis that can coexist alongside gender dysphoria, which is your case. In your case, it doesn't sound like, from what you're sharing, at least here, that your depression is a byproduct of gender dysphoria. Why it doesn't sound like it's a byproduct of gender dysphoria? Because you have tried to minimize the dosage that you were taking of antidepressants in hope to see that you would feel better, and you probably felt worse versus better. In this case, gender affirming surgery will help you with dysphoria if you have genital dysphoria. If your genitals bother you, getting gender affirming surgery most likely will help. However, it also no guarantee that it's going to wipe away your depression, because it sounds like your depression is standalone struggle. And even though you may completely, fully eliminate gender dysphoria, it sounds like that's still going to be present, because it's just something that stands alone, and is completely not necessarily linked at all to gender dysphoria. So that would be my gist to you. Talk to your therapist, see if this sounds like sense to them, what I just offered to you. But for a lot of people who, when I say that your depression tends to go away when you start hormones, it's for individuals for whom depression is a byproduct of gender dysphoria, not when depression is standalone diagnosis. So that's a very clear distinction. So wishing you all the best. Next question. Hello, Dr. Z. I really enjoy your content and it really helps me to understand myself better. You are very, very welcome. And I'd like to ask you some questions. I am a non-binary trans masculine person who lives in Ukraine. I really hope you're okay. I hope you are safe. I hope your family is safe. My heart goes out to you, what's happening to Ukraine. I'm Russian, I'm from Russia, and I am very appalled and deeply, deeply against war of any kind. And I think what's happening is truly, truly, truly horrific. So my best wishes and safety concerns go to you and to your family. And I've been thinking about changing my name to my chosen one, the one that I use in daily life. And I've been using the name for 2 years already. This is great, by the way, very long social transition aspect, 2 years, by the way. So if you've been feeling great 2 years, that's a pretty good indication this is probably the name you're very comfortable with. But I'm feeling scared about it because of our society. I would be too. The names that I want to go by isn't common here. I also have a fear how my family will react about it. And because of other people who's telling me to not change my name, I became unsure about myself. How could I be sure about changing my name and not be scared of changing it because of the fear of regret? Great question. First of all, when you say fear of regret, it's a name. You can change it. You can change it back. When I immigrated to US, I changed my name to Natalie. I can't even remember now. I don't know why. I thought it would be cool to Americanize my name. Then I changed it back to Natalia when I realized that my initial heritage name is way better than Natalie. No offense to all the Natalie's watching. In addition, my mom gave me this name and we share exact same name because we look almost identical. So keep in mind, it's a name. It's okay to change your name. The only thing that's going to be pain in the ass is just going through all the legal loopholes of changing it back. But it's a name. It can be interchangeable. Now, what I'm hearing is this: you tried out this name for a long period of time and it felt really good. It felt very affirming. And then you decided maybe you should move forward to really changing it. And now you're starting to get concerned because you're afraid how your family going to react. You live in Ukraine, which is not as, from my understanding, Ukraine is much more gender forward, definitely not as transphobic and homophobic as Russia is. And you're also starting to have people tell you shouldn't do it. Advice number one: be careful with too many cooks in the kitchen. Okay? When you're a chef and you're cooking up your life in a kitchen, be careful with having too many cooks in the kitchen. And this goes for everybody else who's watching it. A lot of time when we start allowing other people's opinion in, suddenly we start getting into decision fatigue. And as a result, we're starting to second guess ourselves. You know yourself better. 2 years is a long time. If within those 2 years you felt like this thing feels the most comfortable, chances are it is. So be careful what others say. People don't know you as well as you know yourself. So trust yourself. Most likely they're projecting their own insecurities and fears. So I'd really recommend for you to go forward with it because, like I said, it's a name. It's not like you're making a huge drastic decision that's reversible. This is fully reversible. And you know what? If you still feel right now like you're not fully sure, go back to square one. Go back to trying it out. Try to shut down people's advice. Stop asking people for advice. Sit with yourself and ask yourself whether this name really resonates with you, and the answer will come. So this is what I would really recommend for you. And I wish you all the best where you're at. Question number 3. Hi, Dr. C. Thanks for your content. You are very welcome. I'm closing in on a year of hormones and have been fully socially transitioned since November. I have a consultation coming up in September for bottom surgery, and it should be able to be done later this year. As I progress, my genital dysphoria, which wasn't an issue at first, is getting worse, and even imposter syndrome kicks in, and I think people may see me as someone playing dress up. I just feel I won't be I just feel I won't be complete till surgery, and I'm embarrassed to have male genitals, even though I pass pretty well. I even worry my urine stream. By the way, very common, I'll talk about this. Urine stream, when sitting at the toilet, sounds off from what cis female sounds like when in public restroom. Is all of this normal to feel this phase transitioning progresses? Fantastic question. Okay, so you almost a year on hormones. You've been fully social out since November, so you're fully living your life, and you have a consultation for bottom surgery. And now you're starting to get your genital dysphoria is starting to get really worse. One, very common for genital dysphoria to fluctuate, very common for any elements of dysphoria to fluctuate throughout your transition. Oftentimes, what happens is that person doesn't necessarily have genital dysphoria, and then the genital dysphoria becomes very dominant when you start taking care of other aspects of yourself. For example, in the beginning, for a lot of people, it is their physical external presentation that's very visible to everybody else that causes the most dysphoria. Maybe it is their voice, maybe it is their face, maybe it is facial hair or lack of facial hair. And then as you take care of that, if you start feeling more comfortable and confident, dysphoria will shift, and then it will start focus on other parts that make you feel uncomfortable. The more congruent people usually become, oftentimes, not for everybody, but oftentimes, the more they start feeling dysphoria in regards to the body parts, they never noticed dysphoria before. So this is very common. Keep in mind that having consultation for surgery is not necessarily the same as scheduling your surgery. You can consult, and then you can see how the consultation went, what the information stirred up inside of you, how it made you feel. And then you can always make and schedule the surgery later in the year or when you feel ready. So don't feel like you need to go through transition, boom, 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 unless you really feel like you're ready or somewhat ready. Remember, 100% certainty is most likely not going to be for everybody. Now, you're saying that it's getting, your genital dysphoria is now getting to the point where it's actually starting to give you imposter syndrome. To the point where you feel like people are going to feel like you're playing dress up, even though I think you mentioned that you have no problem passing, but you worry about, the fact that you have male genitals, and you even worry about the bathroom stream, right? The pink stream. So also very, very common. It's very common because you're starting to feel more congruent with yourself, and you're having this body part that is not only giving you gender and genital dysphoria, but it is also a body part, I apologize, body part that is constantly reminding you what you're incongruent about. So imagine this. You wake up, you get yourself dressed, you get yourself ready, and you go out there. And when you go out there, you get gendered properly. So the world sees you the way you see yourself. So you get that external validation, and you feel really comfortable, and you feel really good about yourself. Then your brain reminds you that, oh, wait, but I have this consultation for genital surgery. Oh, wait a second, I have this genital surgery because I have this part that is not congruent with who I really am. Then subconsciously, even your psyche is starting to think that you are either, like living a double life, or what if somebody knew, oh my God, people see me as a woman, but I have male genitals. It's all this part from the psyche, all of this learned historical cultural context that starts coming up to the surface and play devil advocates with you. As it plays devil advocates for you, you become more and more paranoid. The more paranoid you become, the more you start feeling like you are a fraud. The more you start feeling like you're an imposter, you're trespassing. All of this is normal. So take a deep breath. Take a deep breath. You're not playing dress up. You're not playing pretend. You are evolving into who you have always been. You have always been a female. You have always been a woman. You are evolving to it right now. And the reason why you're evolving to it right now and not X amount of years ago is because right now you have resources and tools accessible to you. Or maybe right now you're mentally ready to take on this evolution, but you are evolving into yourself. This bathroom thing, this is so common. I cannot tell you how many women, trans women, tell me that they're paranoid that they're going to go in a bathroom and they're sitting there in a stall, and as they're urinating, other women around them are analyzing their stream and are clocking them by their stream. Nobody gives a fuck. Trust me, nobody gives a fuck. Honestly, I cannot tell you how many times, obviously, I've been in a bathroom stall and heard other people pee without even ever even thinking what it sounded like. Nobody cares. Nobody really does. The only reason why people become mindless and mean and hateful is when they visually see a person who, in their mind's eye, doesn't fit their boxes of their binary gender presentation. When they see that, it triggers things inside of them, and everybody has their own triggers. It triggers maybe to some people to a certain extent, to in other people to a lesser extent, but it triggers something. And when it triggers something, that's when people react versus respond. But usually most people don't really care, and those who do, it's because they're getting triggered and they need to work on whatever it is that's bringing up to their service. Majority of people are very mindful. They may get triggered and they realize that, oh, this is, I'm having my own reactions and I need to deal with them. It has nothing to do with the person. The ones who do have a tendency to misgender, to say something nasty back, are always, you can tell, they're people that have very very painful deep wounds that are nowhere near healing. And basically, you being you in the world is like scratching their wound indirectly. That's just how it is. But great question, very common. Try to work on your imposter feelings. Again, you're not faking it. You're not trespassing. You are evolving. Own it, and you deserve it. You should evolve. We all should evolve. Next question. Please, in your Q&A, can you cover why does misgendering and dead naming so painful? Is it re-encountering the trauma of suddenly realizing I'm trans in midlife? So yes and no. So okay, let's cover this up. Sorry, I like blanked out because I saw your name and it reminded me that I have to black it out before I edit the video. Okay. The reason why misgendering and dead naming is so painful, even though you may feel like you don't give a shit and even though you don't want to care, but it still feels very painful, is because every time you get misgendered, you are even non-verbally, the world is telling you you're not you. The world is telling you that you don't belong. The world is telling you so many horrible things. In other words, the world is saying we don't see you. And this is why it's so painful. And there's no way not to make it not painful. It is painful when the world tells us we should not be here, we don't belong, we don't exist in any respect. That's one of the biggest premises of the pain of misgendering, and that's one of the premises why it keeps happening. Is it also painful because you're recounting trauma of suddenly realizing you're trans in midlife? Maybe. It depends how severe your trauma is and what exactly do you mean by trauma of suddenly realizing you're trans in midlife? As in, was it very traumatic for you to realize in midlife that you're transgender? If so, what was so traumatic about it? Because usually for people, it is maybe difficult to realize that, but it's not so much traumatic as more of, lots of things now in my past are starting to make sense. And now I really understand why I was struggling with it. It's a little bit more of, even though it may not be the most happy bearing news for some people, it is a lot of times very illuminating towards their life. But I do think that where it can be more painful in regards to misgendering is that if you have had very painful, stigmatizing, misgendering incidences in the past that were traumatic in nature, I can see how then any misgendering moving forward is going to be even that much more painful because it is also linked and connected to the trauma you have experienced. And once you experience any kind of even benevolent misgendering in the future, it is still going to activate the trauma of being really misgendered in the past if you have not dealt with that. So keep that in mind. But misgendering sucks and misgendering is painful. And I would be, I'd say that a lot of misgendering that is happening, even though it feels painful, is really happens in benevolent cases where people really don't mean to hurt you. They don't mean to misgender you. They spit out whatever their brain first tends to construct in their mind, whatever. We all have these little qualifiers for gender, and they don't really think in their head, oh, I'm going to misgender to hurt you. And then of course there are people who do it on purpose, but a lot of it happens benevolently. So keep that in mind too, is that most people really mean well. And then, yeah, like I said, there are people who are go out of their way to misgender you because, some people, they're like energy, not even energy suckers. I feel there's some people in this world that thrive in a very sick way, in a very unhealthy way, by destroying others. There's something about that that makes them feel powerful and in control and better about whatever they feel about their life. And to me, that's the really sad individual. So um yeah, but I'm sorry if misgendering happens to you. It's very painful. Last question for today. Hello, Dr. Z. Your content has been so helpful in pointing me in the right direction as a trans person. I'm so glad. Something I was wondering is, can tattoos be considered a part of transition? I have body dysphoria and I plan on getting a tattoo next month to help alleviate some of my dysphoria. I see my tattoo as a way to show permanent symbolism and intent about my feelings and desire to transition, and also a way to control and transition my body. I have seen some trans people talk about tattoos as part of the transition, but not a lot. I would love to hear your thoughts on this matter. This is such a great question, and it's such a fresh, unusual question. I love this. So, first of all, viewers who've been with me for years and years to know this about me. I love tattoos. Love tattoos, and there is a tattoo I really want to get, but I will never get because I just afraid that one day I might not like it. So I'm a little chicken shit about it. I love tattoos. So I'm going to be a little bit biased, obviously, because I love tattoos so much. To answer your question, yes, absolutely, tattoos can be part of transition, and they are. Tattoos, keep in mind, is a form of body art. Oftentimes, people use tattoos to commemorate very specific incidents in their life. People will get particular dates tattooed on their arms to commemorate something that really was meaningful in their life so that they can remember it. People will get portraits tattooed on their bodies to remember loved or significant people. People have their pets tattooed on their bodies. So tattoos are really strong, very strongly symbolically connected to ourselves. They're definitely a part of transition. I have seen people who would get a very particular medical tattoos as part of their transition to make some of their scars to seem more minimal. I have seen lots of trans guys would get a penis tattoo on their after undergoing phalloplasty, where a person can create all the intricate veins. I have seen people get nipple tattoos. I have seen it all, and I have seen a lot of trans masculine people get chest tattoos after having top surgery, or non-binary people getting tattoo to cover up the scars or maybe commemorate scars. Absolutely. Absolutely. I think tattoos, um, like anything else, is extension of yourself. And if you have a tattoo in mind and you strongly feel about it and connected to it, and you also realize it is permanent, although you can go through tattoo removal, which I hear is costly. Um, I think it's definitely something to consider. Why shouldn't tattoo be part of one's transition? There's so many things that are part of our transition: clothing, our styles, our mannerisms, our behavior, hormones, surgeries, um, changes, changing legal documents. There's so many elements. The way we even carry ourselves, the way we talk, the way maybe we interact with the world. There's all this intricate things about evolving into yourself that are part of your transition, and tattoos are absolutely part of it, including all other form of art. So if you're thinking about it, and if there's one you really want, and if you're watching this, comment below, share with all of us, what are you planning to get? And yeah, go for it. Your body is your skin, is your art. We all do a lot of things to our bodies. Some people get plastic surgeries to make their faces look better. That's kind of a permanent way of altering your body to evolve into yourself. Some people do a lot of other things. And I think tattoo is just another form of that. So definitely. And like I said, let me know what you're planning to get. Can you see I'm like smiling? I'm like, you're gonna get that too. Uh, so I'm all excited for you. I'm like reliving my tattoo desires vicariously through. All right, so these are 6 questions for today. Great questions. As before, you have a question for me, do put it below in the comment section or email them to me directly, and we'll keep having this Monday Q&A series going as long as I keep getting questions from all of you. Hope you all have a great time. Comment below, share your comments, share your thoughts on what you heard in this video. I love reading all of your comments, and I will see you all next time. Bye.